Hi, it's Paul. This is a pleural fluid on a 68-year-old male. We received 80 mils of bloodstained fluid. Clinical notes stated plasma cell leukemia. See what you think. So what did you think about this? The diff quicks weren't actually a whole lot of use in this case, which is a pity. They were so heavily bloodstained it was difficult to see morphology, but certainly the eye was drawn to some isolated, very large, malignant looking cells. The PAPs were pretty cellular and they contained a rare mesothelial cells and lymphoid cells in the background. There was an outstanding population again of large malignant looking cells that caught the eye, and there were also many smaller cells that seemed morphologically to be kind of similar. The cells were plasmacytoid. They had fairly granular looking cytoplasm with an eccentrically placed nucleus that was usually round or oval, and they had really prominent macronucleoli present. There were quite a few bi and multinucleate malignant looking cells around as well. So what do you reckon? It was pretty easy to say that it was malignant, and it was a fairly poorly differentiated looking malignancy. We didn't have any direct evidence of myeloma, but we had a previous biopsy, I think it was a skin biopsy, in which the clinical notes stated multiple myeloma on bone marrow. So it certainly looked malignant and most likely a plasma cell neoplasm. So an effusion is a fairly rare late complication of disseminated disease in the case of myelomas that portends very poor prognosis, and they vary quite a bit in terms of the cytomorphology, from well differentiated tumour cells that look at obviously plasma cells, often with binucleation, but with that typical plasma cell morphology like this example here. Sometimes you'll see nice clock face chromatin as well as in the example here on the left. Myelomas that are less mature, so more blastic looking, often have morphology like this with some pretty bizarre looking cells, extremely prominent nucleoli present. I guess you have to really exclude other types of malignancies, and I would first of all think really of melanoma with these large binucleate cells with very prominent nucleoli, but fortunately, and as it should usually be the case, there was a history in this case. We performed flow cytometry and it showed a clonally restricted plasma cell population as being present. We also had a cell block, which I showed you. It showed quite nice morphology, and on it where there was weak positive staining with CD79A, CD138, and CD38. So in summary, this was consistent with myeloma presenting in a pleural effusion specimen. So I hope you enjoyed that case. Thanks for watching.